Lynn Sanders will never forget her own decade-long crusade to convince anyone that she was suffering at all. In the spring of 1974, 15-year-old Lynn Sanders had a reputation as one of the best swimmers in the small Wisconsin town she grew up in.
I medaled in the Parkland Conference when you swim against all other high schools, and I took third place in breaststroke, which I was really proud of.
But one afternoon, as she's gliding through the water, Lynn starts to feel something she's never felt before: agonizing pain in her hands.
It was really uncomfortable, achy, like I had the flu or something.
Lynn describes the strange soreness to her mother, who insists on taking her in to see the family doctor. He immediately assumes that the teen has broken a small bone in her hand from the strenuous water workouts. But after taking an X-ray, nothing appears out of the ordinary. The doctor chalks her aches up to growing pains and encourages Lynn to keep her hand wrapped in a support bandage whenever the pain flares up.
Kids are always asking you, why are you wearing that? So you have to explain a story that I just sprained myself. I didn't want to let them know that the doctor just said it was growing pains.
Worse still, as the weeks drag on, the pain in her wrists does not get any better. In fact, they eventually become so tender that she can no longer keep up with the grueling swimming workouts.
Basically, the pain forced me to quit. It was very difficult to quit the swim team, and my parents were disappointed.
Despite the strange looks she keeps getting from classmates, Lynn does her best to just live her life like a normal teenager. She starts going to the local roller rink after school, hoping to make new friends.
It was boys' choice, and I asked her to skate, and we ended up going on another date from that.
During the dating years, I would mention every once in a while that my hand or shoulders were hurting, but I didn't really want to keep mentioning to Dave about all my pain because I didn't want to chase him away.
By the time her senior year rolls around, Lynn is living with chronic pain 24/7. While Dave is essentially unaware of what she's going through, he does notice that Lynn has a propensity to hurt herself.
He would call me klutzy. He would see me do klutzy things.
But nobody realizes just how bad her situation has become. In fact, Lynn's hands have gotten so sore, she's starting to have trouble performing even the simplest of tasks.
I really did feel alone. My mom would tell me to just wrap it up with a bandage and, it'll be better in a couple weeks.
Weeks, then months go by, and the relentless pain doesn't let up, despite the fact that she's wearing the hand braces and taking aspirin 4 times a day. Then, right before graduation, Lynn notices something very unnatural while she's going through her morning stretches.
My elbows looked different. They rotated weird.
I was not aware that Lynn had hypermobility of her joints. It wasn't something that she shared with me or really anyone.
But soon after the young couple gets married in 1978, Lynn can't hide her condition from Dave any longer.
I worked at a daycare. I had a hard time lifting the 2-year-olds. I could feel my shoulders starting to pop out, and I could literally hear it pop.
And it would actually, what they call wing out. It would almost separate from where it's supposed to lie and lie flat.
I would get horrendous pain.
When she can't take it any longer, Lynn quits the daycare and takes on a more low-key desk job. But the daily repetitive office tasks soon begin to take a toll on her as well.
It was getting harder for me to button my buttons on my blouse, turn doorknobs, lift up things with my hand.
Finally, Dave insists that she see an orthopedist to find out once and for all what's wrong with her.
Basically, he comes in the X-ray room and he pulls my hand and separates my wrist during the X-ray, and no other doctor ever did that.
Next, he gives her an extremely thorough exam and even has her perform a series of manual exercises to see how her bones react to movement.
When he was doing the stress test, it was really a horrendous pain. My hand bone basically separated a lot from my wrist bone.
The doctor explains that Lynn's fragile ligaments are so stretched out They're literally unable to keep her bones in place anymore. This allows the dozens of bones in her hands to rub up against each other, causing friction and excruciating pain.
My ligaments were stretching out, and he needed to shorten those ligaments up. He decided that he could do a surgery.
Desperate to make the pain go away, Lynn agrees to the surgery. And 2 months later, she feels something in her hands that she hasn't felt since she was 15. Nothing.
The wrist felt so much better, and it made me feel 10 times better knowing that this doctor actually, I believe, got down to the bottom of the problem.
Over the next 4 years, Lynn undergoes 7 surgeries on various joints. It's the only way she's able to keep the pain at bay.
Again and again, it was one joint and another. One would get patched up and fixed up, and then 6 months later it'd be a different joint that we had problems with.
Then in 1981, Lynn finds out she's pregnant. At first, she and Dave are overjoyed. But it isn't long before the throbbing pains return with a vengeance. And this time, they're not just in her hands. In fact, her entire body feels as if it's been battered.
The OBGYN said that you are stretching out and that you were going to have a little achiness from being pregnant. Oh, my joint pain never subsided during the whole pregnancy. After I delivered my son, I still had that achiness all over.
But before her body has any time to really recuperate, she finds out she's pregnant yet again. And this time, the agonizing pain seemed to have escalated to a degree that she has never felt before.
I thought because of hormonal problems, that would just continue until, your body gets back into normal shape again.
But 3 months after her second boy's birth, Lynn still isn't feeling any better. The pain is constant. She begins to realize that she can't have any more children in this state and goes on the pill.
And I think it was kind of a cranky mom at the time because of all the pain that I was having.
There was always that question of why is all this happening? What's wrong with my mom?
My knee pain was really, really a sharp pain at the time. I could hardly put weight on it.
When Lynn checks in with her doctor yet again, he assures her that the crippling knee pain is simply a side effect of having paper-thin ligaments. The only thing that will help is another surgery. The next day, Lynn is wheeled into the OR. But as the surgeon inspects her knee, he realizes that the damage is far more extensive than they first thought. After completing the complicated surgery, he instructs the team to put her in a full leg cast to help stabilize her fragile knee.
I was thinking, how am I going to take care of 2 young kids with a cast this size where I can't bend my knee?
After 8 days of recovery in the hospital, the surgeon discharges her with strict orders to take it easy. But Lynn is determined to get back on her feet as quickly as she can. And a few days later, she decides to give crutches a try. But as soon as she takes her first step, she notices that something isn't quite right.
I was having a little bit of pain in my calf area, which was kind of unusual because he fixed my knee.
The pain is just getting worse.
By the next morning, her calf is throbbing so badly that Dave insists on driving her to the emergency room. All it takes is one look at Lynn's leg, and the ER doctor knows that she's in serious trouble.
I was very terrified. I didn't know what to expect.
The medical team runs a battery of tests, and within an hour, they know exactly what's going on. Lynn has 3 blood clots in her leg. At any point, these clots could break loose and travel up through her blood vessels. If they lodge in a sensitive place like the lungs, it could kill her almost instantly.
It was, a very dangerous situation. I realized how quickly it could go bad.
They thought they could be from my birth control pills, so they took me off immediately.
Over the course of the next 8 days, they keep a close eye on Lynn as they pump her full of blood thinners to help reduce the deadly clots.
I just couldn't believe I had to go back for another 8 days.
When the team is confident that the young mother is no longer in danger, They release her with a 90-day supply of the blood-thinning medication. Lynn and Dave are hopeful that the worst of it is behind them. But 2 months later, Lynn is caught off guard when her body starts to change again.
I discover that I'm pregnant.
You know, she's in a full leg cast, and somehow or other we managed to, do what young couples do, and she ended up getting pregnant.
But the real shock is yet to come. On hearing the news, the doctor recommends that she terminate the pregnancy. He's concerned that the blood thinners she's been taking could have already done serious damage to the unborn fetus.
Also, they said I could miscarry because of it.
She was pretty broken up about it, and I was just trying to be there to listen and try and understand what it was we were going to do next.
Lynn immediately stops taking the blood thinners and begins researching her risks. When she contacts the March of Dimes, they refer her to Luann Week, a genetic counselor.
We had some uncertainty about the exact timing of her pregnancy and how far along she was. We really have to pinpoint that timing because it makes a big difference as to what the risks are.
The next day, Lynn goes in for an ultrasound, and they're relieved to discover that she's only 5 weeks along. This is good news because the baby was only exposed to the blood thinners for a brief period of time.
As we often say in genetics, nothing's 100%, and so we still had to manage and cope with the fact that there was some uncertainty here.
But Lynn is willing to take the very real risks, especially when she finds out that she's having a girl.
I just broke out in tears because I finally was going to have my girl.
During this third pregnancy, she was in constant pain.
I was in more pain than ever, and I was worried about the baby and if she would have birth defects.
The stress of it all is almost more than either of them can bear. But in the 34th week of her pregnancy, the couple finally hits rock bottom.
All of a sudden, I felt no movement. Here I'm thinking I'm going to have a stillborn, or there's something wrong with my daughter.
Most of the people in Lynn Sanders' life think she's a klutz. They have no idea that the 28-year-old has persevered for more than a decade with chronic and debilitating joint pain.
I had neighbors actually making fun of me, saying, well, what are you going to have a cast on this time?
Then, during the 8th month of her third pregnancy, the baby stops moving, and the young mother knows she needs help.
I immediately went to my OB/GYN. He told me that I was in labor, basically, and that I was going to have the baby 6 weeks early.
It's a tense 6 hours of labor, but on March 18th, 1986, Jessica Sanders is born. And even though she's premature, doctors assure Dave and Lynn that she's perfectly healthy. But Lynn is still very worried that the blood thinners could have affected her baby girl in ways that aren't yet apparent. So she checks back in with Luann Week, her genetic counselor.
I asked her lots of questions about Jessica's medical history, and every question that I asked had a very normal newborn baby answer.
Just to be safe, Lynn continues to take her daughter in to see Luann every 6 months. And each time, she assures the nervous mother that all is well. At Jessica's 3-year checkup, it becomes clear that the genetic counselor is far more worried about Lynn than her daughter.
Luann asked me, every time I see you, you're in a different cast.
So started asking her a lot more questions about her health history. I felt it was important that I make her aware of a condition that might explain her problems.
Lynn can't believe what Luann is suggesting. She spent nearly 15 years hearing that she's just different, but secretly, she's always suspected there was more going on.
I was totally desperate for some kind of answer to all the aches and pain that I had since I was 15 years old.
Luann advises Lynn to get in touch with a genetic specialist immediately. She tracks down Dr. Pamela Trepane and hands over her extensive medical file. Dr. Trepane begins conducting her own investigation by having Lynn perform very specific tests on her joints.
There is a scale that we use to be able to assess joint instability and joint hypermobility.
In other words, how mobile are her joints? Looking at her skin, how stretchy it is.
Based on that type of a physical exam, in addition to her medical history, makes that diagnosis. Lynn has classic features of Ehlers-Danlos syndrome.
Ehlers-Danlos syndrome is a disorder in which a genetic mutation disrupts the patient's production of collagen, a type of protein that acts as a glue and holds our skin, muscle, and ligaments together. Without the adequate collagen, Lynn's body quite literally began falling apart.
Lynn's joint pain is a direct result of the poor collagen and the poor elasticity. Many children, their parents will describe them as being clumsy, when in fact they're trying very hard to keep their whole body in appropriate alignment.
You think back and think, well, maybe she wasn't the klutz that we thought she was. It was related to this condition that she had no control over.
Dr. Trepane speculates that Lynn's pain progressed slowly from her hands and wrists to other body parts because the joints that are used most often feel the wear and tear first.
When Lynn was pregnant, she felt even more fatigued. We're already talking about joints that are unstable, and now you're adding the load of the pregnancy on top of that and a shifting center of gravity. All of those things then will combine to create increased joint pain. Historically, people who had classic Ehlers-Danlos syndrome had incredibly stretchy skin. Within circus environments, you see the people that can stretch their skin, taking their earlobes and pulling them down.
One of the big puzzles, of course, for Lynn was why it took so long for people to make this diagnosis.
She did not have overly stretchy skin. Unfortunately, what most physicians have learned is that's EDS.
While it's reassuring to finally know what she's been living with all these years, Lynn is not prepared for what the doctor has to say next.
There is no cure for EDS. We cannot go in and fix the gene that is making the collagen incorrectly. We can, however, provide good pain control and good physical therapy.
Lynn begins a rigorous course to strengthen and steady her joints and takes prescription medications to help manage her pain. Unfortunately, she will continue to require surgeries to tighten up her ligaments as they wear out.
I'm trying to go and do the best I can each and every day. Every day is a new day.
To date, Lynn has had more than 40 surgeries. She also wears custom-made silver ring splints to help stabilize the joints in her fingers.
I wear these just to prevent tearing in my ligaments in my fingers, and also it really does help with pain.
Lynn is still coming to terms with the fact that her disease will never go away. But she finds her inspiration to face each day through her husband's unwavering support.
It takes a special person to marry somebody and still stand by my side. 33 years since we met.
It's for better or worse than sickness and health, and that's pretty much what I've stood by.
Today, Dave and Lynn remain hopeful for a cure. In the meantime, she's doing all that she can to help patients like herself. In 2006, she started the Ehlers-Danlos Syndrome Network Cares.
You have to be your own advocate. I hope someday every doctor knows something about Ehlers-Danlos syndrome.